When was the last time you checked your blood sugar? And what was the result? There is an alarming fact: every 10 seconds, someone in the world is diagnosed with diabetes. But what's even scarier is that many people don't realize that their daily habits are silently making their condition worse. You may think you're doing everything right, but in reality, some seemingly harmless actions are actually causing your blood sugar to spike or crash uncontrollably. So, what are the most dangerous habits that diabetic patients need to avoid? Let's explore the 6 common mistakes that many people make, and, more importantly, how you can fix them starting today. 1. Poor diet, the number one enemy of blood sugar. Have you ever wondered why your blood sugar keeps spiking even though you've cut down on sugar? The secret lies in the foods you consume daily, not just sugar, but also refined carbohydrates, processed foods, and fast food. According to the American Diabetes Association, ADA, a diet high in sugar and refined carbs increases the risk of insulin resistance, leading to blood sugar levels that are 30% higher than those who eat healthily. Furthermore, a study published in the American Journal of Clinical Nutrition, AJCN, found that consuming processed foods can increase the risk of type 2 diabetes by up to 70%. Which foods are silently damaging your health? White bread, white rice, instant noodles. These have a high glycemic index, GI, causing blood sugar to spike rapidly. Soft drinks, canned fruit juices. Even when labeled low sugar, they still contain high amounts of fructose, which increases insulin resistance. Processed foods, pizza, snacks, cookies. These contain trans fats and refined carbs, leading to sudden blood sugar spikes. Smarter choices. Swap white rice for brown rice. GI equals 50 instead of 89. Choose whole wheat bread instead of white bread. GI equals 53 instead of 75. Drink water or herbal tea instead of sugary sodas. Remember, 80% of your blood sugar control depends on your diet. If you continue to consume low-quality foods, don't be surprised if your blood sugar remains unstable, despite all your other efforts. 2. Sitting too much, the silent culprit of high blood sugar. You might be maintaining a healthy diet, but if you spend most of your days sitting, your risk of high blood sugar remains high. According to the Centers for Disease Control and Prevention, CDC, sitting for more than 8 hours a day can increase the risk of type 2 diabetes by 112%. This happens because prolonged inactivity reduces calorie burning and weakens muscle activity, making it harder for the body to absorb and process glucose, leading to insulin resistance. A study from the British Medical Journal, BMJ, found that getting up and walking every 30 minutes can reduce post-meal blood sugar levels by 30%. However, most people don't do this. Instead, they spend hours sitting at their desks, in cars, and on the couch at home. You don't need intense workouts to fix this. Walking for 30 minutes a day can lower HbA1c by 0.4 to 0.6% in just 12 weeks. Stand up every 30 minutes. Take the stairs instead of the elevator. Use a standing desk or walk around while working if possible. Many people think that exercising for just 1 hour a day is enough. But sitting for the rest of the day still raises the risk of diabetes. The human body is designed for movement, not for sitting still. 3. Eating too many refined carbs, a common but easily fixable mistake. Do you ever feel tired and hungry just a few hours after eating, even if you had a big meal? This could be because you're consuming too many refined carbohydrates without realizing it. Many people believe that avoiding sugar is enough, but in reality, refined carbs can cause blood sugar spikes just like sugary snacks. Foods like white bread, pasta, and white rice have high glycemic indexes, GI, meaning they are absorbed quickly, forcing the pancreas to release large amounts of insulin to process them. According to the American Diabetes Association, ADA, a high intake of refined carbs increases the risk of type 2 diabetes by up to 40%. I understand that changing eating habits is not easy. Many people have eaten white rice and white bread their whole lives, and suddenly giving them up can be difficult. But you don't need to change everything overnight. Try these small but effective changes. Replace half of your white rice with brown rice or quinoa. Use whole wheat bread instead of white bread. Add more vegetables, beans, and nuts to slow down sugar absorption. Most importantly, don't pressure yourself to change everything at once. Every small step you take will help you better control your blood sugar. You are not alone in this journey, and I believe you can do it. This is just the beginning. There are still 3 more harmful habits that many people don't realize they have. Do you want to know the remaining 3 mistakes and how to fix them? Let me know, and I'll share them with you. 4. Smoking, a dangerous enemy for diabetics. Did you know that smoking not only harms your lungs but also directly worsens diabetes? If you have diabetes and still smoke, your risk of complications increases many times compared to non-smokers. According to Dr. David Nathan, director of the Diabetes Research Center at Massachusetts General Hospital, smoking increases insulin resistance, making blood sugar harder to control. Diabetics who smoke are 2 to 4 times more likely to suffer from cardiovascular complications compared to non-smoking diabetics. This was confirmed in a study published in the Journal of the American Medical Association, JAMA, which found that diabetic smokers have a 37% higher risk of cardiovascular disease and a 50% higher risk of limb amputation due to nerve complications. Beyond insulin resistance, nicotine in cigarettes constricts blood vessels, reducing blood circulation to vital organs. This can lead to diabetic neuropathy, causing pain, numbness, and tingling in the hands and feet. Diabetic foot ulcers, slowing wound healing and increasing infection risks. Kidney failure, due to excessive strain on the circulatory system and kidneys. I understand that quitting smoking is not easy, but every smoke-free day is a huge step towards better health. If you're considering quitting, try nicotine replacement therapy, join a support group, or seek medical guidance. Making the decision to quit smoking today won't just help you control blood sugar better, it will protect your long-term health. 5. Chronic stress, the hidden villain that causes blood sugar spikes. Have you ever noticed that your blood sugar tends to rise when you're stressed? This is not a coincidence. Stress can increase blood sugar levels even when you eat healthy and exercise regularly. According to the American Diabetes Association, ADA, when the body is stressed, the adrenal glands release cortisol and adrenaline, 2 hormones that increase glucose levels to provide energy to handle dangerous situations. In healthy individuals, insulin quickly moves this glucose into the cells. But for diabetics, the body does not respond effectively, leading to sudden blood sugar spikes. A study from Diabetes Care found that high cortisol levels over time can increase fasting blood sugar by 23% and raise HbA1c by 0.5% in just 6 months. Stress also creates a dangerous cycle. Stress right-pointing arrow cravings for sweets and carbs right-pointing arrow high blood sugar right-pointing arrow fatigue right-pointing arrow more stress. Lack of sleep due to stress right-pointing arrow reduced insulin sensitivity right-pointing arrow 15% higher fasting blood sugar the next morning. How to break the cycle. Practice meditation or deep breathing. Just 10 minutes per day can lower cortisol by 20%. Do light exercise. A 20 to 30 minute walk daily helps reduce stress and improve insulin sensitivity. Get enough sleep. People who sleep 7 to 8 hours per night have 15% lower blood sugar levels than those who sleep less than 5 hours. Stress is inevitable, but you can control how you respond to it. Start managing your stress today to protect your blood sugar and overall health. 6. Drinking too much alcohol, a hidden danger for blood sugar. As a diabetes expert, I often get asked, can I drink alcohol? The answer is not simple, because alcohol affects blood sugar in 2 ways. Too much can either cause blood sugar to spike dangerously high or drop to dangerous lows. According to the American Heart Association, AHA, excessive alcohol consumption can increase the risk of type 2 diabetes by 43%. The reason? Alcohol directly affects the liver, which plays a crucial role in regulating blood sugar. When your liver is busy processing alcohol, it cannot release glucose into the bloodstream when needed, leading to severe hypoglycemia, low blood sugar, especially for those taking insulin or diabetes medications. Furthermore, a study published in the Diabetes Journal found that heavy drinkers have a 37% higher risk of insulin resistance, meaning their bodies struggle to use insulin efficiently, making blood sugar levels harder to control. How to drink safely if you have diabetes. Limit alcohol intake. No more than 1 drink per day for women and 2 drinks per day for men. Eat before drinking. Helps prevent sudden drops in blood sugar. Choose red wine over cocktails or beer. Red wine contains polyphenols, which can improve insulin sensitivity. If you have diabetes, moderating alcohol consumption is critical. Don't let an innocent habit ruin your blood sugar control. Take control. Your daily habits shape your future. Diabetes is not just a number on a blood sugar monitor, it's a lifestyle. Your daily habits can either help you control the disease or worsen it over time. The good news is, you have the power to change. Just taking small steps, like swapping white bread for whole grains, walking more, and managing stress, can dramatically improve your health. Are you guilty of any of these habits? If so, start making changes today. And if you want to learn about the best foods to naturally lower blood sugar, don't miss the next video. Click here to discover more.